Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Payne with the Ask Dr. Payne segment, where he will answer your cosmetic surgery questions live on the air. Dr. Payne, this week's question comes from Facebook, and the person's asking about a Bodytite Lipo or a thigh lift. Should they have a Bodytite Lipo or thigh lift? They're about 55 years old and have lost a lot of weight, about 75 pounds, looks like. They've had successful tummy tuck and arm lift before, but very concerned about their thighs, and they've been told that a thigh lift is pretty complex. Question is, do you think a Bodytite Lipo would be enough, or is there issues with the skin? Dr. Payne, what do you suggest in this case?
Well, a lot of times things can go either way, but in this kind of question, it's pretty clear. From the picture that was sent, person's got some loose skin, they're 55 years old, not a lot of elasticity, there's been some weight loss, and they've already had some weight loss surgeries in terms of the tailor of the skin. Here, the Bodytite Lipo or any of the non-invasive tightening things aren't really going to work. To get the good result here, thigh lift surgery has to be done. Now, it's not that the procedure is particularly complex. It's that a lot of surgeons aren't real wild about doing it because it is a little more involved than some other types of surgery. It is a potential for some issues if you don't know what you're doing. And some surgeons that may be visiting this field from other specialties are advised to probably stay away from this one. For our practice and what we do in my background, we actually like to do this procedure and we welcome it. So what we will do is usually do the procedure that involves the hidden incision going all the way around the top part of the thigh, front and back. And that incision, the scar, can be joined up to the tummy tuck and will be hidden with shorts. Boxer short style shorts would cover the scar. There's no down the leg scar unless we really need to do it. And some people that have a lot of weight loss and real sheets of skin, then those people are going to need a different type of incision. But in general, I will almost always be able to get a pretty good result if most of the laxity, as it is in this case, is up to the higher part of the thigh. And the procedure, we do it as an outpatient. I have never had a serious problem with this operation. I don't like to do this on smokers because there's a greater risk of issues with the healing, but even in that population, we have done fine with it. So in this case, I would recommend against non-invasive treatments and to think about the surgical procedure because of the reasons I had stated before. And you may want to visit around a couple of different surgeons to make sure you get somebody that likes to handle this procedure. You don't want to have somebody do it if they're not really comfortable with it. There are people, sadly, that might try that, and it's not the greatest thing to do. So if you get that vibe, you might want to check around a little bit to find someone you're comfortable with and that you think is going to do a good job for you. And that way, everything will go, as smooth as possible. So,
well, thank you, Dr. Payne, for your time, and appreciate your time answering that question. And if you have a question for the doctor, please visit our website or Facebook page, LinkedIn, Twitter. And Dr. Payne, we appreciate your time, and we'll see you on the next one.
Very good.